This session aims to reflect on the day's conversations and how they might inform future action. And so to kick that off, we're just going to kind of review some of the discussion in our lunch discussions, and I'm just going to share a few takeaways and comments from that. So one is climate change is an abstract concept. In order to impact community, we need trusted individuals and local institutions to communicate a story that resonates. Climate change-informed health reforms need to address or complement existing local needs. We need to emphasize the importance of asking, what are patient and community actually concerned about? Then ask how our understanding of climate science can inform policy solutions to their concerns. The good thing is we have many solutions under development. We have technology available, we have data, but we need partnerships to put things into action. And private sector leadership has a significant role to play. Hopefully today's event can spur new collaborations and innovations here at Duke, and that includes collaboration between efforts to collect good health data, environmental and climate data, and business data. Researchers are using modern metrics and models to build evidence, and a great place for any organization to start integrating research into policy action is by finding accurate measures where they are now, and then setting measurable goals for where they want to go. The next point is to get specific. During the disaster resilience and emergency response session, participants dove into the critical real-world use case of how to support infant nutrition during natural disasters. Investments in things like breastfeeding support, training food bank partners on how to store infant formula, updating North Carolina Medicaid policies to ensure access to dual electric breast pumps, et cetera. This health policy builds resilience. Citizens may not see the connection between this and climate change resilience, but that's where our storytelling and past experience come in. So with those comments in mind, I'll turn things over to Dr. McClellan. Thank you all.
Well, first off, Jen, thanks to you for that summary. I know you got a lot of help from our other table leaders, some of whom are sitting up here with me, also Rob Saunders, Matt Ambrosio. So I want to thank all of our organizers for making this a collective shared learning effort. And that goes for everybody who attended here in person today. I know those of you who are on virtually, you heard the question in the last session, how do we follow up? How do we have more impact? Obviously, we haven't worked out all of the issues here, despite a lot of great discussion and pathways for action, which I'm going to put you all on the spot for in just a moment. But we welcome further comments. We're on the web at Duke-Margolis, and we'll have at the end some information on how to find us on the web or X or otherwise. And I know our whole collaborative effort with the School of Medicine, the Nicholas Institute, really across Duke University effort here wants to make this continued collaborative effort for progress. And to start that next phase, first off, thanks for all of you for being with us today, for coming in. You're very busy with activities around the country, around the world on all kinds of important issues in healthcare reform. But I'd really like to turn to each of you for some initial reactions. And, Victor, you're now at the National Academy of Medicine. We touched on some of the major grand challenge initiatives related to environment and health and healthcare that you're working on. I guess I'd also point out that we heard from the current acting head of Duke Health, Tom Owens, about how important this set of issues is. You're also a former chancellor here at Duke. The other most recent former chancellor at Duke, Gene Washington, couldn't be here today, but is collaborating with us on this overall effort. It seems like it's telling you something if all of these health system leaders view this as a really important challenge, but also, I think, opportunity. I mean, you're not a guy who spends a lot of time on stuff where you can't make a difference.
Yeah. I think in this case, leadership counts a lot. But I think being able to see what's in the future, actually what's present today, but what's in the future is important. I earlier talked about the fact that if you look at climate change, how's it impacting public health, healthcare, and of course how it's impacting our healthcare delivery system, and how we are contributing to carbon emission. All that simply argues for we got to do something about this. And it's a little bit like, as I said earlier, patient safety, whatever. It's very clear to me that's where the big future issues are. We better get on top of this, right? So I think, I've been very energized by this meeting, looking at what Duke is doing, Tom Owen's discussion, what your faculty are doing, and all that discussion that went just now, North Carolina, is very encouraging. I think what we need to do now is to say, now to recognize the future is here, and we got to do something about this. I think as a good leader, as a good system, as good faculty and as workforce, we need to put our energy together to say, how do we stay ahead? Yeah. So rather than waiting to be asked, we should start thinking about how to plan ahead. Now already, we talked about today, there's already a lot of kind of, shall we say, early movements that says the right thing to do. We didn't talk much about financing, but the Academy have published 2 papers on the business case for climate change and health. One published in Modern Healthcare, one published in our Academy Press, to really make the case that if you did, for example, renewable energy, and this number, you may cost you a little bit extra now, but the savings are huge. Kaiser's permanent saving about $24 million a year from using alternate source of energy. Gunderson Clinic and many others are all doing the same thing. So it's obvious there. Second, I think Carl talked about the waste reduction. That whole area is also another area of savings, right? But I think more importantly is improving the health of the people you care for, but also improving population health. You listen to our last panel, it's very clear that people in the community, or the panel before that, are benefiting tremendously. That's what we do, right? Community benefits. So it aligns with what healthcare should do, aligns with better outcomes for our patients, aligns with the business case, aligns with our equity community issue. That's the case, right? Now, what you want us to talk about, of course, and you're pushing for, is healthcare reform. How do you actually begin to put the right, what Jonathan's doing, metrics that people can measure, know how they're doing, and therefore accountable? Second was, I talked about standardization of supply chain, procurement, how to help the system to be more efficient, effective, and make decisions. Third, we talk about payment systems, right? How to create the right payment system, where eventually the data collected look at both carbon emission, health outcomes, and the both of them together. And then having some value-based approach towards it. We talked about ahead, and I heard a lot about health opportunity, which has been terrific in showing what can be done. Yeah. There you go.
Great. Great summary. Thanks, Victor. Bill, you started out with some optimism this morning, but also agreeing these are some grand challenges. Things that have stood out for you today?
No, first of all, it's been a great day, and really appreciate the opportunity to participate. I think what's been reinforced with me over the course of the day, and especially ending with the last panel, was kind of where I started and where we have ended up, which is also just a starting, I think, as we go forward. I think we need to continue to crystallize the message itself, the why, and articulate it in a way, and it came up at our lunch panel as well, through storytelling, especially if we're going to go beyond a core of people who believe in it and bring more people to the table. And the why is clear. We have to do it, everybody has to do it a little bit differently, depending on who the audience is and who we are. I do it very much through the why of the person and the person's health and well-being now, right now, and their kids. And that's not for everybody, but to basically get that appropriate attention. And then the messenger, which came through today loud and clear, it's all of us. And how we amplify that message in order to take it to scale means we have to have trusted partners in the National Academy of Medicine, obviously the Joint Commission, and all the other groups, the Nature Conservancy. That means collaboration is critical. I mean, why is the Nature Conservancy have one of its 5 big pillars climate change? It's out. I thought the Nature Conservancy was land and just conservation. And that sense of place that the last panel ended with, I agree with entirely. But no, if you really look at what nature can do in terms of nature-based solutions, remember of all these bioemissions that we're putting in the air, 50% today are absorbed by nature and the ocean and trees. And just because I didn't tell it earlier, I'll tell it really quickly because it kind of puts it together. In Louisville, Kentucky, there's a Green Heart initiative. When I had been on the board of the Nature Conservancy for about 3 years, Louisville's not that far away, I got a call that said, come by, we have an idea. If we plant 8,000 to 9,000 trees and have a control area, can we determine over a period of 5 years, 10 years, or 15 years of the why, of the impact you have on human health, and quantify it? And you know, I said, well, trees make me feel good. I like the trees, and I know they pull carbon out, and that sort of species diversity and all can do that. But I didn't know. But the Nature Conservancy put in about $6 million. The NIH agreed to oversee it. Again, credibility. Who are the messengers coming in? And the NIH partnered with the local, the hyper-locality that we just talked about in the last section being so critical, bringing that to the table. If you had those 3 partners, and now 6 years later, the preliminary findings, but published with the control, not control, is that these 8,000 trees that are planted in the treatment arm, and you measure C-reactive protein, which is an inflammatory protein that's measured routinely in all of us today because of the correlation, and maybe causation, but correlation with heart attack, stroke, cardiovascular disease, lung disease is so high. This is chronic inflammation of the body. Plus, we didn't talk that much about the mental stressors of climate change today, but we know it has an impact there. Well, in this population measured, pulling together these trusted partners using science itself, C-reactive protein was about 15% lower in those areas where green trees were planted. And then you sort of say, you know, we got these longer timelines and more value-based outcomes. The next phase of that, of course, is how many fewer heart attacks you actually see. But I think it's a good model of the type of data and surveillance, and we have to have government supporting that surveillance and that monitoring and that data, which through the NIH we have, collaborating with trusted partners, that we can continue to make an impact. And I tell that story because it's a story to me that pulls together so much of what we've talked about over the course of the day.
Yeah, I really like the synthesis example, the story, but paying attention as well to the data and evidence and making it local. John?
Well, first, let me just thank my colleagues to my right, each doing amazing work and frankly, you know, really putting themselves out there to move this dialogue forward. So profound thanks to each and every one of you. Thank you. I had an epiphany today. Societally, we are divided by profound agreement on many things. And this really came out of the table discussion I was privileged to moderate, and just brilliance, especially from the Duke undergraduates at the table. And you know, here's the takeaway. I want to share this because I think we're limited by our ability to really compel greater consensus. And we're divided, ironically, by things that are peripheral. And we can be unified by things that we share as values. And I appreciate, Bill, your injecting optimism. And each of you, Mark and Victor, this morning in our conversations, you talked about how we really need to move forward on areas of agreement. So Here are the takeaways from our table conversation, thanks to all the participants there, is that the conversation should reframe climate and sustainability, obviously away from partisan identity, toward shared health, family, business, and community interests. Messaging should be simple, positive, and actionable, tied to everyday concerns, kids' health, affordability, safety, rather than abstract issues of environmentalism or other political issues. And so the messaging strategy, I thought this was just terrific. Accessible and simple, easily repeatable and understood, successful farming, cost savings, positive framing, emphasizing the common good and shared humanity rather than conflict or blame. Health connections, rather than cultural, political, health and well-being. Again, children's health, exercise limits in playgrounds due to heat, as an example. Nutrition, which links with the MAHA agenda. Concerns about microplastics. A generational appeal to all, thinking about the future, children and children's children. And profit and business incentives. And that means that we reframe climate and sustainability, not in a partisan way, not as a particular issue for any one group, but rather as a health concern relating to air quality, exercise, microplastics, community interest, the local impacts. And Bill Hathaway and others on this last panel just so spoke about the unthinkable happening, and is a shared interest. And a practical reality. How do we create the business incentives and the supply chain for resilience and management? And that means that there are target audiences and messengers, parents and family, business leaders, youth and students, and medical professionals, health professionals as trusted voices that can bridge those divides. As I mentioned, the approaches have to be actionable and they can be amplified by social media and framed in the context not of some broad national or international interest, but in terms of community interest that actually engage all. And that means that finally we have to bring not just the problems to our political and policy leaders, but solutions that can be operationalized and incentivized. So let me just conclude with that takeaway, which really is that we're divided, ironically, in an area where there is profound agreement around issues of family, of business success, and of community interest.
Guys, first of all, thanks for pointing out our students. They do keep us honest and definitely hold our feet to the fire in a good way, definitely in a good way. I would like to ask the rest of you, so messaging is really important. To get to good policy, you need a lot more than that. You need data, evidence, practical pathway to impact based on all that. And we'll get to that in a second. But agreement with John's view about some of the key messaging points, the two words that we came into this meeting with based on our preliminary discussions were sustainability, which is something that people think about in terms of our healthcare system from an affordability and access standpoint in the face of rising cost and health stresses, chronic disease stresses, need for more prevention, need for using resources more effectively. And it seems like a lot of alignment there. And John, you picked up on that theme too. And resilience, which is about the ability not just to respond. I appreciate the point about you then become something better, and that keeps happening. And there too, some of the steps that we need for a resilient healthcare system, one that can help keep people healthy and meet them where they are with better data and better AI and technology to support them acting in ways that keep themselves, their kids, Bill, to your point, their families healthier. Environment's a big part of that. Their immediate environment, the social barriers, the other health risks, but increasingly these climate risks too. Is that a good framing? Anything that you all would like to add to that?
Yeah,
Based on all your
I think
experiences?
it's great framing. In both sustainability and resilience, moving upstream, which we talked a little bit about, because policy can do that. And I think areas that were briefly mentioned, and ways to do that are to look at the greatest causes of disability and burden of disease today. And things like food and the non-medical determinants, which kind of forces you into looking, widening your lens. Again, we caught it in the last panel, I think, really well. And like the Food is Medicine initiative, right now the current administration has put that out there in a way that others have not, and we'll see how it develops. But I think it is really positive because food, and Tufts is doing a great job, I think, right now leading as an academic institution, but in an inclusive way, looking at what food is medicine really means in terms of nutrition, changing the course of the burden of disease upstream to prevent a lot of the health system response, or the traditional health system response that is there. And I would only add that to the framework because at the policy level, whether it's in Medicare, whether it's in Medicaid, how you reimburse things like medically tailored meals, which we know shorten hospitalizations and prevent readmissions. We need to keep getting more data about that, but medical meals, especially with vulnerable populations, but really anyone that are medically tailored to the chronic disease where so much of the cost issues lie, or 70, 80% of the cost lie in chronic disease. And I think including that in the overall discussion when we're talking about environmental impact is important. It takes me to the agriculture world, to food, to regenerative medicine, and that quickly takes me to the Farm Bill and the sort of legislative priorities that are going to come forward to the United States Congress. Maybe not so much to the administration, but to the Congress itself is going to be dealing that in real time. And it's food, it's regenerative agriculture, it's what happens to what government can do in both nature-based solutions to whether it's carbon or sequestration or emissions themselves.
I have a few thoughts. First of all, I totally agree with Bill, and food as medicine is now certainly a big area. I think we need to go well beyond that, as I said earlier in the roadmap, that every sector, right, need to put health in the center. Because when you think about these issues, they tend to be a little abstract when you think about climate and environment, until you see the wildfire and the Helene hurricane, but these are extreme events. So if you put people in the middle of this, that to me is the key. So consequently, we have to think about how are all these things affecting well-being, and how each sector in doing what they do, energy, agriculture, transportation, have they thought about how it's affecting health? Now, if you take a step back and really do analysis, it'll be easy to make a strong case, not only about well-being, but about the economy, because the economic impact on all these decisions are hugely impacting health and its economy. So that's the other point I want to make. You talk sustainability, resilience, I'll say economic impact in a big way. And I think when you talk about talking to people in Washington, policymakers, have they thought about the health and economic nexus, right? Now, the good news is that COP30, which is now coming up soon, Brazil, right? They have a thing called the Perlin Action Plan on Health. Full day dedicated to health, that action plan, and guess what? Equity, people, economic, are straight in the middle of all those things. In addition to surveillance, capacity building, and all the other things. So I would say that's another really important. So the storytelling, I think first we need to be able to educate the public so the public can understand what the impact of climate is on health. And then it's not only the extreme weather, which are really important, but in fact every day, as you mentioned, air pollution, all the water and stuff like that are affecting them. That storytelling is compelling. So a combination of data, storytelling, economic impact will be a lot more compelling, in my opinion.
All right, well, let's take it from there to the path forward on policy. And I really appreciate centering health, and really it's the health of each person, their family, their community that matters and connects the most here, as Bill emphasized. And just speaking, my other degrees in economics, and one extremely important predictor of long-term well-being is economic growth and people being a part of that. So translating that into action requires really making our healthcare system, all of us who are working in it, more accountable for those individual health, family, and community and economic well-being issues, and that gets us into policy. We started out in thinking about sustainability and saw, I think, a lot of alignment between sustainability from an environmental standpoint, sustainability from a cost, affordability standpoint, which in turn helps people stay healthier, improves access to care, enables more economic growth and well-being. And I would say that there were sort of direct components of that, Coral and others talking about how we actually have, and John, I know you've been working on this, Victor, some of the health system collaborations you mentioned, that if you make some investments to reduce waste, to increase reuse, to change to less energy intensive approaches, those do have financial returns. We have metrics for those. I'm not sure how well we're using them, but that's the pathway to very much aligning with policy priorities around better outcomes, lower cost. We had a lot of discussion about scope 3, contractor activities, et cetera, and their metrics for that seems like could fold in well. I'd like to go beyond that a little bit, though, to, I guess, what you might call system-wide sustainability. So beyond just making your current practices more efficient and more environmentally sustainable, which can be done at the same time, and we can keep generating and strengthen the evidence and the accountability and measures behind that. I remember when I was in medical school, one of my advisors had a big lasting impact on my career, said the most expensive piece of equipment in medicine is a clinician's pen, because that's what determines how everything else gets spent. I think today it's that clinicians, EHR connected iPad and their ambient listening system and the infrastructure and AI behind that, but that gets to sustainability from the standpoint of less economically intensive models of care, but also less environmentally intensive models of care. And we had some great discussion on one of the previous panels about, and some of you too, about value-based care reforms and the ability to, and this gets to that connection to people, identify for each individual what is their biggest health risk that's most actionable and what's the most efficient and effective way to address that. And there's been a great discussion today to encourage and build on I think the expansion of thinking that's gone on around that. It certainly fits with what Tom Owens was talking about before, about identifying patients at high risk and building it in systematically. It obviously fits in with the community-based infrastructure with healthy opportunities pilots. It fits in, Bill, with your point about food is medicine. And again, here, and Cody mentioned this on the last panel, the point of the Healthy Opportunities pilot was definitely to strengthen communities and address these upstream needs, but it was also associated very much with accountability for, can you do this in a way that actually reduces healthcare spending at the same time? That seems like a framing that can bring a lot of what we've talked about together for some next steps, but I appreciate reactions about this thinking of sustainability and how we turn it into data, evidence, metrics, and alignment with accountability in healthcare systems and the payments and regulations that support it.
I'll start.
Okay, great. Thumbs up?
Yeah.
All right, well, then let's talk about resilience.
Well, can I make a comment?
Yeah, please, go make a comment.
When you
We
get
still
behind-
got 5 minutes, so.
When you get behind MAHA, really the fundamental issue is that as a society, we are not healthy. We have excess avoidable disease burden. And if we can reduce the burden of disease, we can become more economically productive, we can become more secure. 1 out of 3 of the young individuals who seek to enlist in the armed forces are turned away, not because they're unfit, but because the armed forces don't think they can get them fit. And so this is an area where if you actually take it to first principles, the issue is really that we can reduce the intensity of healthcare if we can improve health. And I think the points that Bill made, and their elements, Victor, the grand challenges in terms of getting to health are critically important. And then leads to practical policy implications in terms of productivity, supply chain resilience, the utility of investing in the local economy, food as medicine, imagine incentives for local food, et cetera. That also in turn improves the robustness of the supply chain. And then finally, for the healthcare workers, there's a human dimension of this. If you look at the social determinants of climate risk, they look an awful lot like what we already accept as health-related social needs.
Yeah, I just add, and Victor, you want to add something
Yeah.
here, is we have to do this while paying close attention to spending. The healthcare budgets are not going to be getting bigger. There's a lot of pressure to keep it down. That adds a degree of difficulty, but boy, there are a lot of good ideas about how to do that, including healthy opportunities.
That's why the business case is so important.
Yeah.
I was just thinking, someone said that to me about, this conversation with the insurance industry payers. So I was just thinking the component we need to bring in is private sector and payers, right? We talk a lot about Medicaid, but there's so many commercial payers out there. I think Cody or somebody talked about an example of one payer ready to pay, the others are good. I think that is an area that we need to pull in. And I think you have the ability, Mark, to pull them in to this conversation, right? Yeah. Standardization, expectation, and what are they doing equivalent to the healthy opportunity area?
Well,
Same for private sector.
Yeah, it is the payers, but it's also the behind the payers, or who's actually paying the payers, so they can pay the providers. It's healthcare, the purchasers. So that's CMS, federal government on behalf of American taxpayers. It's the state that is overseeing. Cody, I think, has put some steps in place, and I know we've got a lot of collaboration going with the health plans here around moving together and doing it in a hopefully less burdensome way as a result for healthcare providers, and instead of just paying for services, moving to paying for better health and outcomes and supporting improvements in the way that the healthy opportunities and similar programs work. The state treasurer oversees the state health plans, one of the biggest employers in especially rural counties, very much aligned with these goals.
But Mark, I totally agree. But I'm thinking about commercial players and how employers, in fact, are paying all those.
And the employers are
right,
very
right?
important for this.
So that's why I mean, you got to get the business sector into this equation. Actually, it works for them. And earlier, someone talked about supply chain. Imagine that how the business is being disrupted with extreme events also, right? And so I think what we're not missing, we need to pull in the private business sector and the commercial payers and the employers into this discussion as well.
Sounds like a great next step. In our last minute, just to add on to that, I did want to come back to the previous session, which, I just want to thank Susan, Bill, Cody for being here, coming from across the state, and thanks for getting in that tourism plug. I've been back several times since then. It's great, especially this time of year. So it does emphasize how if we get this right and focus on supporting people, and boy, we've seen disaster response work, and I was at CMS for Katrina. It's sort of the earlier technology version, the same thing. You can get all kinds of FEMA supplies there. It's happening in COVID too, but it's that last mile. It's the, knowing the right driveway to go up, having the trust of the person who's going to answer the door there that you cannot replace with technology. As I think the last panel discussed, you can absolutely augment it with better data infrastructure and help support these community health workers, teams that are gonna, I think, make up the future of a more effective healthcare system, one that's better able to manage any threat that's thrown at our communities. My favorite one of my favorite guiding principles for public policy came from Mike Tyson, which said, everybody's got a strategy until they get hit. And the nice thing about these community resilience approaches is they are really adaptable, especially the better data you get and the more you can leverage, whether it's disaster response or extreme health event, a mass shooting, all these terrible things that happen, as well as managing medical benefits or SNAP benefits, leveraging those together. We do need to wrap up, but I did want to get that last point in. And anything else you'd like to add before we finish today? We've got more work to do, and this has been a great foundation
in 30
for it.
seconds, I think the last panel caught it. The things I wrote down: invest in social drivers of health, obviously with North Carolina's Healthy Opportunities. Build hyper-local networks before crises, which comes down to cultural understanding, compassion, diversity, the sort of things that you have to do. Third, I wrote down relationships are core infrastructure. It's people. And so much, especially having been in Washington, people say, well, the answers in Washington are, Washington's got the answers, they got the money and all. But if you listen to the last panel, it was really more what happens in the community, locally, the trust, the messenger, the interpersonal relationships. And you just basically said the same thing. But it's both, clearly. But it means, and this is where my optimism comes, because I think right now, if you look at climate change overall, probably 80% of the work is at the state level, and Bloomberg says it all the time, and at the local level, coming down to the cultural level. And I think America is coming together much more around community now than it used to be. You come out, again, forget what's going on nationally in different ways, but the strength of communities and the fabric of communities and that interwovenness has got so much of the answers when crises do occur or when we see this impact of this elevated hotter temperatures, unstable weather patterns.
Let me just add to that, a ditto on everything. And then I want to transect the question that Chloe asked with a comment that was made in the last session, which is that the time to establish relationships is not in the disaster, it's before the disaster. Yeah. But to the point of resilience, while you learn from the disaster, don't underestimate what you learn by rehearsing for the disaster. And the identification of need in that process not only can build resilience, but it can bring out solutions to many of the challenges and areas that Senator Frist just identified as primary drivers.
I think that's one of the best underrated or underused metrics for effectiveness of disaster response is, do you have those trusted relationships in place, especially with those who are going to be at risk, the most underserved and vulnerable population. Sorry, Victor.
No, my last comment is hyperlocal. Duke. Thank you for doing this. There's enormous talent and passion, compassion, energy. They are in different places. They are in Fuqua, Nicholas, School of Medicine, you name it. Bring them all together. Now, I know climate is a big initiative at Duke, but climate and health, you just begin to touch the surface.
Yeah.
And we heard some of the discussions. To me, people working here, working there, boy, what an opportunity to bring them together.
Yeah.
And I'd love to see Duke Health System transform itself as a leader in this area, right? And along with the business school and others to make it work. So it's very exciting for me. I would say my last point would be, what an opportunity for Duke. I'm very proud of it.
Yeah, and I do want to thank the Duke Endowment for sponsoring this event, the Climate Collaboration Symposia. But Victor, I especially want to thank the people who are with us today, who made this possible, the organizing team across Margolis, the medical school, the Nicholas Institute, Rob Ty, Jennifer Lawson, Rebecca Whitaker, Rob Saunders, Jennifer Edwards, Melissa Fernandez, Luke DeRocher, Hannah Vitello, Joss Wilson, Kate Miller at Fuqua, who helped us get this together, and of course, Matt D'Ambrosio. So I want to thank all of them for bringing us together. And then last thanks is to all of you who have helped us take some concepts and give them a big push forward into practical, actionable steps for policy, for leadership in healthcare organizations, for impact together, working together at Duke, in our community, our state, and our nation. And Victor, Bill, John, we're going to keep calling on you as we continue these efforts together. Thank you all so much today.
Thank you.